Nurse to patient ratios. I'm guessing you're asking yourself, what does this mean, right? Well, let's break this down. Basically, we're nurses and the people we look after are the patients. A ratio indicates the relationship between two things. Nurse to patient ratios are two numbers, and its relationship is seen in the number of nurses allocated to care for a number of patients. What is the problem? In Australia, throughout the years, nurse to patient ratios have been identified to be a major factor that is affecting all areas of acute hospitals, including other health related facilities, and the relationship between staff during working hours. This can be demonstrated by the increase in the statistics of Australia, such as within a study, 4.1% represented the hospital mortality rate, as this would increase by 3% every day due to the ward having low staff. Why is it a problem? Within the Australian health system, patient safety and quality care are two well-known factors that health professionals base their practice on. With poor nurse to patient ratios, it has been causing numerous issues such as an increase in preventable errors, including medication errors, and the consequent increase in mortality rates. This also affects the well-being of nursing staff due to having to work overtime hours, making them more prone to fatigue and injury. Currently, in today's health system, governments are still working towards a possible solution to improve nurse to patient ratios. In July 2018, the state government announced that hospitals in Victoria would receive $50 million that will go towards education and employing 600 nurses and midwives. A solution to this problem is that there needs to be a balance of workload as well as skills between nurses. Also, having an effective collaboration of teamwork and communication among colleagues. By doing this, it will reduce the heavy workload, improve the trusting and working relationship between both nurses, and improve the workplace environment. As a study in 2017 decided as a solution to decrease the heavy workloads is to work together as a team and have an effective and respectful communication. Why is it important? With regards to patient safety, as mentioned before, having a good ratio will decrease the chances of increasing mortality rates by minimizing medication errors and reducing the development of avoidable actions, such as falls, pressure ulcers, and healthcare associated infections. Healthy workplace includes a relationship between all staff members, including other health professionals, as well as the type of environment that patients or family members visit. For example, having a good relationship will reduce the level of fatigue. This can be done through the trust and collaboration of teamwork by nurses to complete a workday's routine. Therefore, having a healthy workplace, it minimizes the chances by having a low well-being and causing a type of injuries, such as needle stick. How can effective leadership resolve this situation? In the nursing career, leadership in a hospital can be any member of staff, but normally it is allocated to a person who has higher experience. Leaders can use a three-stage method to professionally allocate nurses to their patients. This three-stage method is known as macro, meso, and micro. Macro represents the organization level of the workplace. By doing this, it will reduce fatigue levels, create a welcoming environment, and improve the delivery of care. Meso includes the educational view, but also the benefits of having good communication skills, such as communicating to each other about a new medicine charted or procedures that have been booked by a doctor for a patient. Micro focuses on the physical and emotional view of a person, which becomes helpful during allocation, as some nurses will be able to handle patients that can become non-compliant, aggressive, or even patients that will need a lot of attention and care. By using this method, leaders will know how to allocate and partner nurses up. Therefore, work will be completed in time and have minimal complications. Explain the background of the concept skill. In the early days, nurse-to-patient ratios were not recognized until it was legislated by the Labour government in Victoria back in 2015. Even though during 2000 an initiative agreement was made that had already included ratios. This agreement did not cover certain health facilities, such as private not-for-profit hospitals, residential aged care, and public mental health. As the years went by, the agreement removed ratios but was taken over by the task force, which aimed to develop improvements and work with the Minister of Health. Due to this collaboration, the Safe Patient Care Amendment Bill 2018 was developed in Victoria that outlines the benefits of having proper ratios, which led to the development of the same bill in other states of Australia. Explain what my responsibilities are as a new graduate nurse. In Australia, every nurse will have a different level of responsibility due to the level of experience that the individual may have or if they are a senior nurse. New graduate nurses will consistently gain additional skills and experience during their transition, such as the ability of allocating colleagues to their patients, but also balancing the skill mix to deliver quality care. This makes them better equipped and can contribute to safe patient-to-nurse ratios. Due to this, it is important for new grads to seek assistance from senior staff and the CNE when necessary. For example, when encountering a task that they have no experience in, to maintain safe care and the values behind nurse-to-patient ratios. Another responsibility is communicating effectively about any issues to a fellow colleague or team leader. For example, new grad nurses should communicate to their team leader once they realize that they have a heavy workload due to the patients that they were allocated to. If needed, after discussing this with the team leader, it can be escalated to a senior nurse, the NUM, or even the CNE, as well as coordinating with your partner, which helps in completing tasks in time and reducing workload, like administering medications. Therefore, it will reduce time consumption and equally balance the workload between both nurses. Explain how the contemporary research policies support my presentation. This research supports my PowerPoint by demonstrating the changes that nurse-to-patient ratios have went through throughout the years in Australia. It also shows how these changes have improved the health system, as well as help to identify strategies and methods that can be used by all nurses to properly assign patients, supported by guidelines and policies. In addition, it has helped to gather important information which can be used for educational purposes to both new graduate nurses and can be a refreshment for senior nurses. Therefore, in the career of nursing, evidence-based research has been identified to be the number one source of information, which is used to improve current guidelines and policies for both public and private hospitals in Australia. Aim of presentation. My aim of this presentation is to educate new graduate nurses on nurse to patient ratios and show how important it is to know how to do it and how it can help when used in practice. As well as my reason to present it this way is because people have different forms of learning and gaining information, such as auditory or visual, which are videos, PowerPoints, music, listening, or even reading. By doing this presentation as a visual stimulus, I will be able to retain the attention of my audience and verbally express my dot points in an easier manner. Explain how communicating information about nurse to patient ratios and the mode of presentation supports effective leadership. The importance of nurse to patient ratio can be presented in any form. Leadership is defined as a person who is willing to step forward to guide people through difficult pathways to then finally achieve an ending goal. This PowerPoint demonstrates to be a form of leadership as we are verbally expressing essential information that can become useful within practice. It is also educating new grad nurses on how to assign, identify skills, and manage patient requests but also complicated situations. A leader will have to do these things so that his or her team can function properly, as well as be looked up to as a mentor for younger staff, including nursing students. Thank you for your attention and the end.